There are many common misconceptions about pain that make us think about pain differently than most people consider it. For example, when a patient comes to see me to figure out where does their pain come from and to play CSI for pain, I've developed 4 rules that we're now talking about as the Blatman method of CSI. And those rules are, number 1, you can't believe where you think you hurt. For example, your headache doesn't come from your head. Your left arm pain could be your heart attack. You have no idea where the pain really comes from. You just know where you feel it, and you really can't believe that piece of the equation. Your knee pain may not come from your knee, and the low back pain you've treated for years and not gotten better may not be coming from your lower back. Rule number 2, it's not important how you perceive the pain. Specifically, our brain cannot tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy. And we spend so much time in our history trying to tease that out. But our reality is, the brain can't tell the difference, and the difference doesn't matter. What does matter is the particular or specific distribution of that sensation. But the way you perceive that sensation is not diagnostic. Rule number 3, the things that you can believe, and what you can believe exclusively or importantly is, is that where specifically you are tender is where the fascia strings that hold you together are tied in a knot, or where they hold on to you and hold you together where your injuries are. And rule number 4, specifically the things that are most tender usually generate most of the pain you think you have. So, rule number 5 is the rule of treatment. If you can get the body to heal the things that are most tender and make those tender things less tender, you'll watch the pain you thought you had go away. And so what we find is that most pain is actually directly related to injuries through time that have happened to you since you were a child, and as your fascia decompensates and your body gets older and more fragile and you lose your resilience, and as the inflammation in your body from the food you eat starts to overpower your defense mechanisms, you now end up in pain that you never had before. And in order for that pain to go away, the food needs to change, and the injuries that caused this pain need to be healed. That's way different than what we talk about with pain. So, for the compounding pharmacist to be able to help osteoarthritis and degenerative joint disease, we're taught that when we have cartilage in our joint, we are born with a level of cartilage that we now have for our lifetime. And once we use that up, we're done for. And I need to ask you, does that really make any sense? We grow a new intestinal lining every 3 days. We grow new skin every week. We grow new brain cells. Does it make any sense that we don't grow new cartilage just to respond to daily wear and tear? So if you're going to change a joint, you need to change the basic equation of the balance between wear and tear and your body's ability to rebuild. And one of the things that we've found as a hallmark to what we do is to inject glucosamine into the joint, to apply glucosamine transdermally through the skin. Those help satisfy this equation and change the balance between wear and tear and ability to rebuild. And it's the compounding pharmacist that I get those products from. And it's the compounding pharmacist that has helped me restore so much joint function to so many people over the last 20 years.